If you're older and you masturbate, watch this first. Let's talk openly, honestly, and without shame. As men age, your body changes, your hormones shift, your recovery time becomes different, and your sexual habits can start influencing your physical and mental health more than you realize. Masturbation is normal. It's safe. And for many men, it's an important part of maintaining sexual confidence. But the real question isn't whether you masturbate, it's how you do it, how often, and what impact it has on your long-term well-being. A lot of older men ignore the signals their body sends. They push through fatigue, numbness, or decreasing sensitivity without understanding the long-term consequences. What matters most is being aware of your habits. Are you relying on porn more than real connection? Are you using masturbation as a stress escape instead of addressing the actual stress? Are you masturbating in a way that damages your sensations over time? These are the questions you need to ask, not to judge yourself, but to protect your sexual health. Your body deserves respect. Your penis deserves proper care, and your mind deserves clarity. What you do behind closed doors impacts your blood flow, your prostate health, your erections, your hormones, and even your sleep quality. Masturbation is not the enemy. Lack of awareness is. When you understand how your actions influence your body, you can make choices that help you age stronger, stay confident, and keep your sexual function alive for decades. So let's break down the key things every older man needs to know. As you get older, the way your body responds to sexual stimulation naturally changes, and one of the most important factors to pay attention to is how often you masturbate. Many men assume frequency only matters when they're younger, but in reality, aging makes your tissues more delicate, your nerves less responsive, and your recovery time much longer than before. When you were in your 20s or 30s, you could masturbate multiple times a day and bounce back with no problem. But once you reach your 40s, 50s, 60s, and beyond, each session impacts your body differently. Your penis relies on proper blood flow, healthy nerve function, and balanced hormones to perform at its best. When you masturbate too frequently, especially back or over several days without proper rest, you can temporarily overwhelm those systems. This isn't about shaming yourself or labeling masturbation as harmful. It's about understanding biology. Your nerves need time to recover. After ejaculation, your body enters a refractory period where sensitivity drops and sexual arousal decreases. When you're younger, that window is short. As you age, it naturally gets longer. If you ignore that and continue forcing stimulation, you may start noticing things like reduced sensation, longer time needed to climax, weaker erections, or even a lack of sexual motivation. These changes can worry older men, but they often have a simple explanation. The body is overstimulated and needs recovery time. Another issue is that older men often rely on masturbation as a coping mechanism for stress, loneliness, boredom, or habit. Doing it out of emotional need rather than physical desire can lead to patterns that the body struggles to keep up with. If you're masturbating when you're tired, dehydrated, stressed, or mentally drained, your sexual performance will naturally feel weaker because your overall energy is low. Your sexual system isn't separate from the rest of your health. It's connected to everything from your sleep quality to your blood circulation. When frequency becomes too high for your age, you may also notice a decline in natural morning erections or reduced spontaneous arousal. That's because frequent ejaculation, especially when combined with intense stimulation, uses up more neurotransmitters like dopamine and oxytocin than your body can replenish quickly. With age, these chemicals restore more slowly, which means high-frequency masturbation can leave you mentally and physically depleted. The key message is not stop masturbating, but give your body time to recover. Your penis needs rest just like your muscles do after exercise. If you allow yourself proper intervals, 48 hours, 72 hours, or whatever your body naturally requires, you'll find that your sensitivity returns, your erections feel stronger, and your overall sexual confidence improves. Listening to your body is the best way to maintain healthy sexual function as you age. Frequency becomes a tool, not something to fear, but something to manage wisely so that you can enjoy a long, vibrant, and satisfying sexual life. One of the biggest issues older men face when masturbating is something they often don't even realize they're doing, using an overly tight grip. This habit develops gradually, almost without awareness, especially as sensitivity starts to decline with age. When your nerve endings don't respond the way they used to, you naturally compensate by applying more pressure, squeezing harder, or stroking faster. At first, it might seem harmless, and for many men, it becomes the only way they can climax. But over time, this death grip technique can significantly affect your sexual performance, both during masturbation and real intimacy. The penis is filled with delicate nerve fibers that are responsible for sexual pleasure. When you use excessive pressure repeatedly, these nerves can become desensitized, making it harder to feel arousal from lighter, more natural stimulation. This means that when you're with a partner, the sensations they provide, whether through touch or intercourse, may not feel intense enough to excite you. This is one of the most common reasons older men report difficulty finishing with a partner while having no problem finishing alone. Another issue is the mismatch between stimulation during masturbation and during sex. A tight grip creates a friction level that the human body simply can't replicate during intercourse. Real intimacy involves warmth, softness, and natural movement, not the firm, controlled, repetitive motion that many men create with their hands. When your brain becomes conditioned to expect that intense pressure, it begins to rely on it as the primary trigger for climax. This conditioning makes partnered sex feel less satisfying or less stimulating, leading to frustration, performance anxiety, and even erectile difficulties. The death grip habit can also start affecting your ability to maintain an erection. Over time, overstimulation from excessive pressure can lead to a form of nerve fatigue. When nerves become tired or desensitized, they don't send strong enough signals to maintain arousal. This is why some men notice their erection weakening midway through sex, even though they can masturbate without issue. The body simply isn't used to the more gentle sensations of real interaction. Another factor to consider is friction. As you age, your skin becomes thinner, drier, and more sensitive. Using too much pressure without lubrication can cause micro irritations on the skin of the penis. These small irritations may not be noticeable immediately, but repeated over time, they can lead to inflammation, sensitivity loss, or discomfort after ejaculation. Lubrication becomes increasingly important for older men, not only to protect the skin, but to reduce the need for excessive force. Reducing the grip isn't always easy, especially if your body is conditioned to expect it, but you can retrain your nerves by gradually loosening your grip, slowing your pace, and introducing lubrication to allow a smoother, more natural movement. It may take time, but your sensitivity can return and your ability to enjoy both solo and partnered experiences can improve significantly. The goal is not to stop masturbating, but to do it in a way that protects your long-term nerve health and keeps your sexual performance strong. Porn can be a powerful stimulus, especially for older men who may be dealing with changing hormones, slower arousal, or reduced sensitivity. But the problem isn't porn itself, it's the way your brain adapts to the level of stimulation it provides. Porn is engineered to overstimulate your mind with constant novelty, visual intensity, and exaggerated sexual scenarios. When you regularly masturbate to porn, especially as you age, your brain's reward system starts to rely on that intense stimulation to become aroused. This can affect your real-life sexual performance more than you might expect. Your brain releases dopamine during sexual arousal. It's a natural chemical that motivates desire and pleasure. But porn floods the brain with dopamine far more quickly and intensely than real intimacy ever could. Over time, your brain becomes less sensitive to that dopamine. This means you may start needing more extreme videos, longer sessions, or more shocking content to feel the same level of excitement. This is not a moral issue, it's purely neurological. And as you get older, your dopamine receptors naturally become less responsive, which makes the effects even stronger. Eventually, this can create a gap between porn and reality. What happens on a screen becomes more stimulating than what happens with a partner. Some men notice that they can get hard immediately for porn, but struggle to maintain an erection during real sex. Others find that they can only climax with porn and not through physical touch alone. This isn't because something is wrong with their masculinity or sexuality. It's because their brain has adapted to artificial stimulus and now struggles to respond to normal human interaction. Another consequence of heavy porn use is unrealistic expectation. When you constantly watch scenes where men last extremely long, perform with perfect erections, or engage in exceptionally intense acts, you may start comparing yourself unconsciously. This comparison builds pressure, stress, and performance anxiety. Older men whose bodies already require more patience and different forms of stimulation may begin feeling inadequate or worried. That stress alone can weaken erections, reduce libido, and create a cycle that becomes harder to break. Porn can also affect your emotional satisfaction. When you use it as a coping mechanism, whether for stress, loneliness, boredom, or habit, it trains your brain to link sexual release with quick visual reward rather than connection. Over time, this can reduce your desire for real intimacy or make you feel disconnected during sex. The more porn trains your brain, the more your natural arousal pathways weaken. The good news is that the brain can reset. Cutting back on porn, switching to imagination, or masturbating without visual stimulus can help rewire your brain to respond more naturally. For some men, this change may take weeks, for others, a bit longer. But sensitivity improves, erections become more stable, intimacy feels richer and more exciting. The goal isn't to quit porn forever unless you want to. It's simply to take control of how it shapes your arousal so your sexual performance stays strong as you age. When it comes to masturbation and aging, one area that often gets overlooked is the prostate. This small gland plays a huge role in your sexual function, your urinary health, and your overall comfort as you get older. Many men don't realize how closely their masturbation habits are connected to how their prostate feels and functions. Ejaculation helps clear out fluid that tends to build up in the prostate's ducts. When done in moderation, this can actually support better prostate health by preventing stagnation. However, when ejaculation becomes too frequent or too intense, especially as you age, it can also create irritation, inflammation, or discomfort in an already sensitive gland. As men get older, the prostate naturally enlarges. This doesn't always mean cancer. Most of the time, it's benign enlargement, something extremely common after age 50. But an enlarged prostate changes how your pelvic region responds to stimulation. If you're masturbating aggressively, rushing, tightening your muscles, or forcing ejaculation, you may accidentally place extra pressure on the prostate. This pressure can lead to that dull ache some men feel deep in the pelvis after orgasm, or the discomfort during urination that shows up a few hours later. Many men ignore these symptoms, assuming it's just age catching up. But often, the body is signaling that your habits need adjusting. Excessive masturbation can also cause temporary inflammation of the prostate, especially if you already have mild enlargement. This is sometimes called prostatitis. It may not be caused by infection. It can simply be the result of irritation from too much stimulation or too frequent ejaculation. Symptoms include pelvic heaviness, lower back ache, burning after orgasm, or a feeling of incomplete emptying when you pee. These symptoms might come and go, and many men never connect them to how often or how intensely they masturbate. Another important factor is the pelvic floor muscles, which sit just below the prostate. When you masturbate in a rushed or tense way, these muscles often tighten without you even realizing it. Over time, chronic tightness in the pelvic floor can compress the prostate area and contribute to discomfort, difficulty maintaining erections, premature ejaculation, or the sensation that your orgasm is weaker than it used to be. The prostate and pelvic floor are closely connected, so poor habits in one area affect the other. Moderation becomes key. Masturbating too rarely can lead to fluid buildup and congestion, which sometimes causes discomfort. Masturbating too often can irritate the gland. The sweet spot varies for every man, but the goal is balance, listening to your body's signals instead of forcing it to perform on command. If you notice soreness after ejaculation, cloudy urine, pressure in the pelvis, or reduced force in your stream, consider adjusting your frequency or technique. Supporting your prostate through hydration, regular movement, gentle pelvic relaxation, and mindful masturbation habits can make a noticeable difference. As you age, respecting the sensitivity of your prostate becomes essential for maintaining comfort, healthy erections, and long-term sexual confidence. The goal is not to avoid pleasure, it's to engage with it in a way that protects the gland that supports so much of your sexual health. Another factor older men rarely think about when it comes to masturbation is the pelvic floor, the group of muscles that sits deep in the lower body and plays a critical role in sexual function, bladder control, and overall comfort. As you age, these muscles naturally weaken, tighten, or become imbalanced depending on your lifestyle, posture, and habits. What many older men don't realize is that the way they masturbate directly affects this muscle group. During arousal and climax, the pelvic floor muscles contract, and when used properly, this creates a strong, pleasurable orgasm. But when those muscles are repeatedly clenched, strained, or overworked during masturbation, it can lead to long-term dysfunction. Most men don't consciously control their pelvic floor during sexual activity. Instead, they tense their body without realizing it, tightening their thighs, buttocks, lower abdomen, and especially the pelvic floor. This tension often increases when men rush masturbation, try to finish quickly, or use techniques that involve squeezing or bearing down. Over years, this can train the pelvic muscles to stay overly tight, and an overly tight pelvic floor is just as problematic as a weak one. It can disrupt the nerve signals that support erections, reduce blood flow to the penis, and lead to discomfort or pain after ejaculation. One of the most common issues linked to pelvic floor dysfunction is premature ejaculation. When the muscles are chronically tight, The body loses its ability to control the timing of orgasm. The pelvic floor becomes hypersensitive, reacting too quickly to stimulation. Some men think this is a hormonal issue, but in many cases, it's a mechanical one. The muscles are simply overstimulated from years of clenching during masturbation. Another problem is difficulty achieving or maintaining a firm erection. If the pelvic floor is tight, it can restrict proper blood flow or interfere with the natural expansion of the penile tissues. Men may feel their erection start strong but fade too quickly, or they may struggle to maintain hardness during certain positions. Tension in the pelvic floor can also cause post-ejaculatory pain or a feeling of pressure in the perineum, that area between the scrotum and the anus. Some men describe it as a dull ache, a pulling sensation, or a throbbing that lingers after orgasm. This is often a sign that the muscles are fatigued or irritated. Unfortunately, most men continue their habits without understanding the deeper cause, allowing the issue to worsen with time. Relaxation is key. Masturbation should not feel like a full body workout or a tense sprint. Older men benefit from slowing down, breathing deeply, and allowing their pelvic muscles to stay relaxed during stimulation. Deep breathing helps the pelvic floor relax naturally, reducing pressure on both the prostate and surrounding nerves. Using a comfortable position like lying back or sitting with good support can also prevent unconscious clenching. Strengthening and relaxing the pelvic floor through exercises like reverse Kegels, gentle stretching, and mindful breathing can dramatically improve erection quality, orgasm control, and overall sexual satisfaction. The goal isn't to stop masturbating, but to do it in a way that supports pelvic health rather than strains it. When the pelvic floor works in harmony with your body, sexual performance improves, orgasms feel fuller, and long-term discomfort becomes far less likely. Your sexual performance as you age is influenced far more by your daily lifestyle than most men realize. Many older men blame masturbation for every issue: weak erections, low desire, slow arousal, or reduced stamina, but the truth is that the foundation of your sexual health is built on the choices you make every single day. Masturbation can only affect you within the limits of your overall health. If your blood flow is poor, your hormones are imbalanced, or your energy levels are chronically low, no amount of perfect technique will fix the deeper problem. Your body needs support, and as you get older, the connection between lifestyle and sexual function becomes stronger, not weaker. Blood flow is the most important factor for healthy erections. The penis is a vascular organ. It relies on strong, steady circulation to achieve and maintain firmness. But as you age, conditions like high blood pressure, high cholesterol, diabetes, and stress can restrict blood flow long before you even notice other symptoms. If you sit for long hours, skip physical activity, or live with chronic stress, your circulation slows down. This makes erections softer, shorter lasting, or more difficult to achieve. Masturbation isn't the cause of this decline. Poor lifestyle habits are. The body can only work with the quality of blood it receives. Sleep plays a massive role as well. Older men often underestimate how powerful rest is for sexual function. Nighttime is when testosterone is replenished, when your nervous system resets, and when your body restores the chemicals that support libido. If you're sleeping 45 hours a night or dealing with irregular sleep patterns, your hormone levels decline faster. This leads to lower desire, weaker morning erections, and slower recovery from ejaculation. Many men think something is wrong with their masculinity when really their body is simply exhausted. Hydration is another overlooked factor. Dehydration thickens the blood, reduces lubrication, increases fatigue, and makes it harder for the body to respond to sexual stimulation. Even mild dehydration can cause a noticeable decline in erectile firmness. As you age, your thirst sensation becomes weaker, so you may not realize how much water your body truly needs. Stress is one of the biggest enemies of male sexual performance. When your stress hormones, especially cortisol, stay high, your body automatically reduces testosterone as a protective mechanism. This hormonal tug of war can leave you feeling mentally drained, sexually uninterested, or unable to maintain a strong erection. Stress also tightens the pelvic floor muscles, disrupts sleep, and increases unhealthy habits. Masturbation often becomes a coping mechanism which isn't harmful on its own, but when done with a stressed body, it may worsen fatigue or reduce interest in intimacy. Your diet also shapes your sexual health. Foods high in sugar, processed fats, and salt weaken blood vessels, increase inflammation, and reduce testosterone. On the other hand, foods rich in antioxidants, healthy fats, and minerals support circulation and hormonal balance. Older men who introduce simple changes like adding leafy greens, hydration, mild exercise, and better sleep often notice dramatic improvements in their sexual performance within weeks. The truth is simple. Masturbation doesn't harm you nearly as much as an unhealthy lifestyle does. Take care of your body, and your sexual strength will naturally stay alive, responsive, and reliable as you age. At the end of the day, your sexual health is not defined by age, and it's not defined by whether you masturbate or not. It's defined by how well you understand your body, how respectfully you treat it, and how willing you are to adapt as you grow older. Masturbation is not the enemy, ignorance is. When you know how your body works, when you pay attention to the signs it gives you, when you stop forcing yourself into habits that no longer serve you, you regain control over your confidence, your energy, and your performance. Growing older doesn't mean losing your masculinity or losing pleasure. It means becoming wiser, becoming more intentional, and learning what your body truly needs to stay strong. Everything you do, how you eat, how you sleep, how you move, how you think shapes your sexual strength far more than any single action behind closed doors. So don't be ashamed of your desires. Don't fear your natural urges. Just understand them, respect them, and channel them in a way that keeps your prostate healthy, your pelvic floor balanced, your nerves responsive, and your erections powerful. Your body is still capable of pleasure. Your sexuality is still alive. You only need to guide it with awareness, patience, and care. If you're older and you masturbate, this isn't a warning to stop. It's an invitation to do it smarter. Your health, your performance, and your confidence are in your hands. Treat yourself with wisdom, and you'll continue to enjoy a strong, satisfying, and fulfilling sexual life at any age.